An endoscopy simply means looking inside the body. Gastroenterologists do upper GI endoscopy, which looks down the food pipe, the esophagus, and into the stomach and the duodenum. And they also do a lower GI endoscopy, which is a colonoscopy, or sometimes a more limited exam called a sigmoidoscopy. Some gastroenterologists will also do endoscopy to look at the bile ducts. That's called an ERCP, but I don't do those procedures. So, from my point of view, endoscopy is upper or lower gastrointestinal endoscopy. And endoscopy is just the generic word that we use for any procedure that looks inside the body. Endoscopy is very safe. There are patients who are not suitable for endoscopy if they're very frail, if they're very unstable, if, for instance, they have breathing difficulties or swallowing difficulties or mechanical obstructions. There are reasons where we would be very cautious about doing an endoscopy. But in most cases, endoscopy is a very routine procedure. I very rarely do an endoscopy without counseling the patient about the risks and the benefits and the alternatives, because there is an informed consent process, of course, as you would expect. So patients are told what to expect. The upper GI endoscopies into the stomach is a very, very safe procedure. There are really it's very uncommon to get any side effects or any complications. It depends a bit whether or not we do any therapeutic procedures, and the complications are specific to those. The lower GI endoscopy, in a similar way, it's a pretty safe and routine examination because we do screening colonoscopies now on very fit people. There is a quoted risk of about 1 in 1,000 of causing problems with damaging the bowel or bleeding. But again, that's mostly if we do anything in terms of therapy, like taking away polyps or doing procedures. So generally, the procedures are very safe. They're very well tolerated. A diagnostic endoscopy of the upper gastrointestinal tract takes perhaps 10 minutes. It's pretty quick. Obviously, if we need to do any therapeutic procedures, that can take a bit longer. A diagnostic procedure of the lower gastrointestinal tract, if we're doing, for instance, a colonoscopy, is about 30 minutes. The key thing there is that we take our time steering our way in to make sure that it's as comfortable as possible for the patient. But then we take particular care on withdrawing the scope, because it's then when we look at the lining of the bowel, where we look for any abnormalities, and when we do any therapeutic procedures like taking a polyp away. But about 30 minutes would be an average for most lower gastrointestinal procedures. So side effects of endoscopy, I'll do the upper gastrointestinal endoscopy first. Sometimes, because patients have to swallow a camera, they can have a little bit of a sore throat, although we do use a local anesthetic spray, which makes this pretty comfortable for most patients, really. And then when people get over the sedative that we normally give, they'll wake up feeling perfectly normal. Often they don't remember having it done at all, and really experience no adverse effects at all. From when we look at the lower gastrointestinal tracts, the most difficult bit is probably preparing for the colonoscopy, because you have to take some preparation to clean out the bowels, and that takes most of the day before the procedure. People and patients need to know about that, and they're counseled accordingly. But then they come along for the procedure, and generally they choose to have either no sedation or some gas and air or some drugs. We tailor it to the patient to make them as comfortable as possible. When we steer through the bowel, it can be a bit uncomfortable as we go around some bends, although that's generally pretty well tolerated. And we put some gas in to see where we're going, but that's absorbed. That's very, very quickly absorbed. So 20 years ago, we would say people might have problems with bloating or distension or discomfort for a couple of days. That's very unusual now. Most of the time, people wake up after having had a colonoscopy or a sigmoidoscopy and feel, they can go straight back to work, for instance, and they feel completely normal. The most important thing is that people often want to eat because they haven't eaten for the day before the procedure, and so they go straight back to normal diet, eating what they want, doing what they want straight away, really. Recovery time depends a little bit on the um, drug, the sedative or the preparation for the endoscopy. So I routinely do upper GI endoscopy and lower GI endoscopy without any sedation if the patient wants that. Some patients elect to have some medication or some drugs, and we would routinely use a painkiller such as fentanyl or pethidine and a sedative, a bit like Valium. Usually it's called midazolam. That lasts for a couple of hours so that although the patients wake up very quickly after an endoscopy, we do request that they have someone to take them home if they've had a sedative, because I don't like sending patients out into the big wide world unaccompanied for a couple of hours. So patients are ready to leave within an hour or two of the procedure, and if they've had sedation, they take probably 3 or 4 hours to return to normal, although we do say that they shouldn't drive a car for the day of the procedure.